Suppose you did a PhD on a sort of a comparison of various, persons seeking mental health care from different systems. Like, for example, those people who sought mental health care from so-called psychiatry, allopathic psychiatry, and those people who sought mental health care from Ayurveda psychiatry, and those who have been going to religious places. And I suppose you have made a comparison of satisfaction among the clients who have just been moving to these different centers of treatment, so-called treatment. What was the finding, and how do you look at the finding, and what is your view?
Yeah, well, that study I did in the 1990s.
That's your PhD thesis, I suppose, right?
That was a PhD thesis, and then later on it became a book. I published a book on that study, and I guess I would to sort of summarize it into two findings. One of them is that among the three therapies I looked at, allopathic psychiatry, Ayurvedic psychiatric interventions, and religious healing, no therapy was simply better than the others. Instead, what I found is that some therapies worked for some people, and some worked for others. So
in that sense, would you say that at least maybe it may differ from person to person, but overall, if you make a comparison, would you say that religious therapies are also as effective or as ineffective as allopathic psychiatry?
Well, I tried to study to what degree patients improved or declined over at least a 6-month period. So it's not a very long period, but it's some evidence. At least 6 months, 6 to 9 months.
That's a good time.
It's okay. Yeah. And I found that the people in religious therapies did slightly better.
Better than?
But it was not a statistically significant finding. There wasn't enough,
in
patients to, exactly.
But in terms of analysis.
In terms of the numbers. So my conclusion was actually that all three did roughly equally well. But it certainly is worthy of more studies, because there have been people from NIMHANS who've studied people who've gone for mental health treatment at temples, and have found some improvement. Certainly, I mean, we know that there's a powerful suggestive effect that the mind can have on the body. I would say the suggestive effect of the mind on the mind is even more powerful. And
than the effect on body.
Exactly. If the idea of belief and your confidence are enhanced, I think that changes your neurochemistry. As do pills. But at least if you do it through a religious interaction or perhaps counseling, I think you know how to do it yourself. You learn how to do it.
Probably that is much more culturally, accepted. I mean, when you talk in terms of religious therapies and all.
Well, there's that too. Exactly. It's easily culturally accepted. I mean, there's, I think people are very reluctant to accept.
No, but what about the satisfaction factor among these three groups?
Well, there's that. Yeah, actually, another main finding as I looked at the aesthetic, visceral effect. What did it feel like to undergo therapy? I got this idea from the patients themselves. And this is because patients, for example, at the Ayurvedic mental hospital, which I went to in Kottakkal, were telling me that they enjoyed the therapy they were getting. Like the Talapodichil and Pichu, they were like a spa therapy. They felt relaxed, and cool and calm. And I thought that's very interesting. At the people in the Ayurvedic, the allopathic.
Did they receive any aromatherapy too? Pleasant smell?
I don't think that they did aromatherapy at that center, but they did in some places Dhumapana, the sort of medicinal cigar inhaled through the nose.
Inhaling.
Exactly, and Ayurveda also has its pharmacology. In fact, the first effective antipsychotic in Western medicine comes from Ayurveda, from the plant Rauwolfia serpentina. It was, there's a story of how this happened in the 1950s, and that may also be a factor. But the sort of pleasantness of undergoing Ayurvedic treatment was really very much appreciated by the patients. Some of those patients I interviewed had left allopathic treatment because of electroconvulsive therapy, which can be quite dangerous.
ECT, shock treatment.
Shock treatment, yeah. Or side effects of the medications they were taking, they found to be rather unpleasant. So some of them left therapy and pursued Ayurveda because there were fewer side effects, and they found the therapy more enjoyable to undergo. And so I think that's an issue of ineffectiveness, because if your patients are leaving because they don't like how the therapy feels, the effectiveness actually becomes a mooted issue. And I think you need to. So in that study, I thought that we, in biomedical allopathic medicine, we could learn from this. That maybe to make mental healing environments sort of more aesthetically engaging. Places for people to help facilitate recovery. I think it's really important that people should be able to learn from different systems and cultural differences.
So you mean to say there is a need to have an integration of these various systems? probably give a better result?
Exactly. I think we should look at what each system does well.
Okay.
And adapt it to other systems. And we should look at cultural, social differences to find out what's going well in some place and what's going badly in another place, and hopefully adjust and learn from these experiences.
Okay. So with all this thought, let me ask you a question in a nutshell. Based on all these various kinds of thoughts that whatever we have had right now,
Okay.
what do you think, like, is it that India has to look for mental health, better quality of care from US or the other way around?
Well, I think if we're going to be objective and look at epidemiological studies, the U.S. should be looking to India for ideas about how to improve, because India is doing better. I'm just being scientific about this. I mean, that's a strange thing to hear for somebody who maybe works in international mental health, because you assume a developing country must always have a problem that you have to solve. Of course, that's not to say that there aren't problems here.
Yeah, that's right.
Of course, there's problems here. There's definite need for improvement in mental health in any place.
That's right.
But we shouldn't assume that the U.S. has the answer. I mean,
so you don't think that US has the best practice systems?
currently the system is not working very well in the U.S. right now. And India has a long history of trying to understand the psyche and the self, going back to the Vedas.
That's right.
That's one of my original intrigues with India as a college undergraduate student. I remember reading the Upanishads and thinking, this reminds me of modern psychology. That in India, people have tried to understand the nature of the self.
That's right.
And our relationship to our emotional lives for this long. I mean, and philosophers, Shankara, Vivekananda, Aurobindo, all of these people have worked on, in the US, understanding the self has never been such a major focus.
Okay.
I mean, in the West, you have Freud, you had William James, and you had
That's right.
psychologists who worked on this,
right.
but India has a long tradition of studying. And I think that looking to some of these local understandings of psychology and the self is a resource that should not be overlooked in India and should not be lost.
Okay.
And I know many people are looking at that here. I know people at the University of Kerala and other places who take very seriously India's own indigenous psychology traditions as well.
Yes. So, Murphy, we had lots of topic covered in our discussions,
yes,
and on behalf of MindWatch, I'm extremely grateful to you. And let me thank you for your, your views and suggestions and your academic exercises, whatever you have done right now. Thanks a lot.
Okay. All right. Well, thank you for having me. I appreciate the opportunity to speak to you and to people in Kerala about these issues.
Okay. Thank you.
Okay.